is Erica Lanfear. Today I'll be talking about speech sound disorders, which the acronym is SSD. If you see me looking back and forth, I'm looking at some notes that I have written down. Speech sound disorder is a communication disorder, okay? That is not a language disorder, it's how somebody communicates. That involves difficulties in the production of sound. This means that, like, for me, for instance, I might have a hard time pronouncing words and trying to get what I'm trying to say if I'm talking to somebody else. So they might not understand what I'm trying to say. With those people that have a hard time articulating sounds, using correct phonological patterns, and I'm going to just give you an example of what I mean. Probably giving examples better than trying to say it. Example is if a little kid is trying to say stop, they might go stop, stop, and we're trying to understand what you're talking about top, but they're actually trying to say like stop, leave me alone. So that's a way of what that means. That's their phonological pattern of how they, when I say they have a hard time doing that, this SSD is usually diagnosed by speech language pathologists. They have to do quite a bit of assessments. It's just not like, oh, they don't know how to say a word, they have a speech sound disorder. No, they have to go through some tests. And a lot of times sometimes the schools might notice it. So it's good that if a parent notices it, but sometimes a parent might not. They just might think, oh, that's normal. They're having a heart, they'll grow out of it. So that's what speech pathologists have to do. They have to figure out, okay, if it's just something that's like natural that they eventually, or do they actually have a disorder? They might use certain procedures when trying to diagnose in certain assessments. They might do a case history. They might talk, interview, an oral examination, a hearing screening, speech sound inventory, some standardized test assessments. They might do an IQ test. There's different things that they might do to try to make sure that this person's just not going through a normal stage, or if it's just, or actually a speech disorder. Because kids usually do have, like, early on, like what I was talking about earlier, little ones, like when they're learning how to talk, they might say, stop, 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 when they say stop, but then eventually they'll get the S to stop. They'll just resolve naturally as they're hearing and learning how to speak more often. So after the speech pathologist and the examination comes after a certain time, if they're still like 7 years old and they're saying stop at 7, they'll need to be examined just to say, hey, is this something that a speech sound disorder or what? But that's just a little bit up in a little nutshell about speech sound disorder. But if anybody's seen this and if you think your child might have it, just go to get with their pediatrician, and maybe your pediatrician can refer them. So I hope you guys have a great day, and bye.